Hi, my name is Leonard Jason, and this is a workshop presented at the SCRA Biennial Conference. This is actually occurring the day before, just so that we can get this on tape. The title of my talk is Encountering Inevitable Roadblocks in the Policy Process. When one does policy research, often one has experiences where one gets either frustrated, disappointed, discouraged, let down, even feeling sabotaged at times, as well as angry. These are natural kind of things that actually are felt by people who do policy work. And the question is, how do you maintain your work when you have these types of obstacles, these types of hurdles? And these hurdles can basically come from people who are state and federal levels, powerful folks who are trying to keep the status quo. They can occur from struggles from community partners. They can be involving even community activists who maybe are misinterpreting your work. And they can also be frustrations from your own colleagues and peers as you're trying to do policy work. These are just a few of the types of hurdles that we basically encounter in doing this type of policy work. So what I'm going to basically suggest is a couple different possibilities of how to deal with these inevitable obstacles. And I'm going to suggest that one way of dealing with this is to focus at a higher ecological level that basically gets beyond the hurdles. Another basically way of dealing with this is to kind of, in a sense, try to bring the adversaries into the policy process with relationship building. Another way of doing this work is to challenge those who might be misrepresenting the policy findings. And the last way that I'm going to briefly discuss is to be aware of resources before us. Really, in a sense, very Kelly-esque concept of cycling of resources. There's often resources available in our environments if we can sort of make use of them. So each of these is going to be talked about. And the first one I'm going to talk about is a case study involving basically Woodridge, Illinois, where we basically worked with a police officer in the police department that was able to successfully reduce underage sales of tobacco to minors from 70% to 0%, where we basically did compliance testing. And Woodridge, Illinois actually was the first community in the country to show that they could actually reduce illegal sales of minors to tobacco. And after we got some publicity for this project, the city of Chicago asked us to replicate the work in Chicago, where there's thousands of merchants versus about 26 in the suburb of Woodridge. And we did work with Chicago for a couple of years, trying to basically replicate this research and showing, once again, that if you sent minors in and that if merchants sold that, those minors, and there was consequences, you could actually reduce rates of tobacco selling, which is, again, 3,000 to 4,000 children begin using tobacco each day. So we want to basically stop this, which is tobacco, as we know, is the largest killer of people. Over 400,000 people are dying each year of tobacco-related problems. So I was pretty excited that we were able to basically do something in Chicago. Mayor Daley at the time had a press conference where we released the findings, and we were really thinking that this would be disseminated. Chicago, really the first community to show that we could reduce illegal tobacco sales. And I actually had the script that the mayor was going to use for the press conference, and I was the second person to actually address a series of reporters where we were going to talk about we could really get something done in Chicago to reduce the illegal sales of tobacco. And what happened was, right before the mayor started talking, he actually used a different script. And why? Because he basically had people from the Illinois Retail Association get to him that they didn't want consequences for selling minors tobacco. They wanted to basically keep things educational approaches, which don't work. So you can basically say, you can educate merchants, tell them it's not a good thing to do, but they're still going to do it unless there's consequences. If they can really actually have fines and even lose their license to sell tobacco products if they do this type of thing. So if you really have consequences, you can have an effect, but the retailers didn't want that. So Mayor Daley changed his tune, and rather than us implementing this basically throughout Chicago, it turned out that we couldn't, because they were going to continue to focus on something that wasn't effective. So at the local level, Chicago, it was very frustrating. And I actually ended up writing an editorial for one of the newspapers concerning what I thought, and it was actually pretty difficult to go on after the mayor and talk to these reporters when I heard what he was going to do with our findings, which I had been told was going to be very different. So we stopped working with basically the city of Chicago because their policies were just not going to basically deal with the problem. So one thing that one can do when one has this type of very frustrating, difficult situation is move up the ecological level to a higher level of analysis. And that's what we did. Officer Talbot from Woodridge had become a national expert from the work that we did collaboratively to show that we could actually reduce illegal sales of tobacco. He ended up testifying federal legislation called the Signer Amendment. The Signer Amendment required every state in the country to basically do similar types of legislation that we basically did in Woodridge. So while Chicago didn't work and we were frustrated working with them, we basically took it to the higher level. And the higher level was national amendment dealing with legislation that basically ended up actually reducing illegal sales of tobacco for the last few decades because of this work. So if you get stuck at one level, sometimes the best way of doing things is go to the higher level if you can to basically solve these types of problems. The second story I'm going to tell about is not dealing with actually individuals who might be having power, as with the first one, which is legislators, people in mayoral office. This had to do with the government. The government's NIH and CDC set up a committee to basically redefine chronic fatigue syndrome. I'm going to call it ME, myalgic encephalomyelitis. And the working group basically kind of recommended an instrument that our group at DePaul had basically developed to measure one of the cardinal symptoms of this illness called post-exertional malaise. So we had this instrument that was a screener. It wasn't a comprehensive measure, but our measure called the DePaul Symptom Questionnaire measured 54 items in all the different symptoms of ME. But they basically said, use these 5 items and this will be your comprehensive scale. Well, that comprehensive scale wasn't measuring lots of things that involve post-exertional malaise. When you basically push yourself and you basically feel ill, that's very complicated to measure, not by a screener. So when the patient community heard that basically they were recommending our instrument, the patient community rose up against it. And they had literally hundreds of posts on different bulletin boards basically saying this was a mistake to basically recommend this instrument. And they went on to basically say what we really need is something much more general, that's much more comprehensive. And they said these are the types of things we need to measure. Well, so you can be attacked in some ways by people who are representing a legislative body, and you kind of feel good about that because you can sort of fight them and go up an ecological level. But what happens when the community activists who you've been working with for several decades basically start focusing on your work and basically saying it's not representative of what they want? Well, it was not representative because it was a screener. It wasn't a comprehensive measure. So very defensively, I basically went and posted my explanation and basically tried to explain it. Didn't get very far with that, and actually finally decided that maybe there isn't an instrument, but rather than being defensive about it, why not reach out to the patient community and sort of have them help create a new instrument? And that's what we did on the Facebook pages. We basically sort of put out a general description. They basically brought their feedback in, and in hundreds of iterations of this, we eventually developed a measure that when we put it out, within a couple days, over 1,500 people had completed it. Again, showing that if you basically work with the patient community and have them come up with the things they feel need to be measured, you can overcome one obstacle of people feeling like they've been left out of the policy process. So this is another example of what one can do, basically involving collaboration. Another quick example of kind of what happens with the policy front is involving recovery homes called Oxford houses. And as some of you know, I've been involved in working with recovery homes, as I have with the ME area for several decades. But what happened in this particular situation was that a lawyer called up and basically said that there was a court case going on, and the people in the community were trying to get rid of the recovery homes, Oxford houses, by setting up legislation saying that you couldn't have a house that had more than 5 unrelated people. Well, small houses are very difficult to have financially solvent. So you really need to have like 6, 7, 8, 9 people in a house so that you can share expenses and make it work. So what they tried to do was close down these 2 Oxford houses. What I did was, with my students, we gathered some data, and what we found was actually larger houses actually had better outcomes. That particular data actually ended up being used in several court cases, including the one that the lawyer asked me for, which successfully had courts allow people to sort of keep the recovery homes going, so that they overruled the particular injunctions that were coming against the court cases. However, I felt pretty good, and our team felt good, that we had helped a community organization be successful. But then what happened next was, several years later, we heard that some community groups were actually using our findings to say larger houses are better. So when you have this kind of opioid crisis going on, we have houses now that are actually very large, has nothing to do with a really good, we think of an Oxford house or a well-run house that has maybe 7 to 10 people. These are houses for 15 or 20 people. And they're using the data that we published to support the fact that they're basically, it's okay to have larger houses. So this is, again, a misrepresentation. We basically said houses that are larger, but not that large, would basically be acceptable. And have these types of good findings. So this is another thing that's frustrating, that sometimes you'll do work, it'll be misused, and the only really thing is that there are different communities out there. There's communities of people who feel it's appropriate to have recovery homes that are appropriate and small, and there's other communities that feel they want to make some money and they're going to try to get the largest kind of flop houses they can. And that's a reality. And we as activists in policy need to recognize that we have to get our word out in whatever way we can to combat the misrepresentation of our work. The fourth case study, real briefly, that I wanted to talk about is this introductory free community psychology textbook, which again, we've talked about. You can get criticized by government officials who are elected, and you have to fight those battles, which can be frustrating. You can get basically also feeling that even the groups that you're working with, the community groups, could have data that could be misrepresented, and how you can reach out to be allies with them. And we also talked about other community groups out there might take your findings and basically, again, misrepresent them, and you have to be an advocate. Well, this was a situation where we came up with, we thought, a great idea, and we put it on the SCRA listserv, and we had 19 chapters suggested, 50 people working on this. We thought that an introductory free community site textbook was a value concordant with the mission of SCRA. We thought that just by doing this, we would get all types of positive recognition and acceptance and buy-in from the organization that we were part of to basically forward the mission. Well, that can be also frustrating, because you might have a great idea and your coalition that you're working with might have something that you think is wonderful and needs to be adopted. That doesn't mean that your friends and colleagues might think it also has to be adopted and has to be something that has to be disseminated. So everyone has their list of priorities, and what this is really talking about is agenda setting. And that, in a sense, we might have an agenda that we think is important, but other people have their own agenda. So part of your work in the policy front is to sort of get your agenda, sort of in a sense, to get onto their agenda so that they prioritize something that you think is important. And that is a fundamental, important piece of this work. And yet what happens when the organization doesn't seem to embrace this particular idea? So we kind of talked to some of the leadership within SCRA, and they said, well, write a grant. That will sort of show a way of people kind of, in a sense, getting more invested. So we did. We wrote a grant proposal. We submitted it a year ago. Didn't get funded from one of the bodies within SCRA. And we said, well, they asked us, okay, we'll write another grant, an innovation grant, and that's one way we want you folks to get money. Well, we wrote a second grant. We submitted it, spent a lot of time on it, didn't get funded. So we had several examples of writing grants to try to get a buy-in from an organization. Well, it becomes even more painful when the people who you feel have your ideals, your values, your points of view, don't jump on the idea. Well, I think this is where two critical issues of policy work come in to sort of deal with this frustration and difficulty. One is, basically communications. We have to communicate our vision, just like in the other examples, constantly communicate it, try to get the word out. And the second piece, which is also important, is relationship building. And how do we build on our relationships with people who might not maybe agree with us? And by doing things like setting up meetings, conference calls, having people invited to sessions at ECO Conference and MPA, where we can dialogue about this particular product. So slowly over time, we were able to kind of think about how we could get their investment in the process so that they would basically see this as really an incredible opportunity for our field to give something away for free and lower barriers of participation in the organization. And when I kind of talked about cycling of resources, this is a Jim Kelly idea, there's often resources that are available in our environment. And if we make use of them, we can possibly deal with some of these hurdles and barriers to the types of policy work we're talking about. And one example of that is we didn't get funded for the 2 times that we tried to get funding, but one thing we did do was we basically wrote a grant to the Vincentian Fund, which is part of DePaul University, got some money so that we were able to do some of the work that we wanted to do without the funds. And even better, when SCRA has this biennial conference going on, we were able to take some of our money and actually become a sponsor for the conference and give them the money. And by giving them the money, that again showed them that we were partners, that we were someone who was a credible kind of individual, and that really helped solidify our relationship with that organization so that they would become even more responsible and more interested and more willing to kind of, in a sense, disseminate what we think is a very important idea for the field. So there are a lot of challenges to doing policy work. It's emotionally grueling. Have allies, whether it be community members and activists or friends. Sometimes we need to go to higher ecological level, as with the tobacco story, bring in alienated community members as partners with ME, challenge misrepresentations of our work, as with recovery homes, or find alternative resources, as with the textbook project. Thank you.